The World Health Organization says most people with mild cases of COVID-19 should be okay again within 2 weeks. But thousands of patients are experiencing serious physical and mental symptoms months after they've apparently recovered from the disease. They can include fever, vision problems, burning skin, exhaustion, hair loss, brain fog, and shortness of breath. It's unclear how common this is. Our Dr. Tara Narula spoke with several people, sometimes called long haulers.
The car ride home was amazing. The skies never seemed so blue, or the air didn't taste so crisp.
COVID-19 survivor Ernesto Castro says the day he left the hospital was one of the best days of his life.
Did you feel you had survived, you had beaten this, or were you still having some issues at that point?
Being in the hospital for so long, being in the isolation, it was really hard. I knew that my muscles atrophied. I could hardly walk. Immediately when I got out of the hospital, I felt like I got a new opportunity.
Late March, Castro was in the hospital for 10 days with severe COVID-19 symptoms. He was put on a ventilator in a medically induced coma. Months later, it's clear his battle with the disease is not over.
I'm still not 100%. I still feel tired. I still have no stamina.
Doesn't look like much, but to me, it's kind of like Mount Everest I have to do every day.
Candace McKinney was hospitalized for COVID-19 for 4 days in April, but she never went to the ICU. In May, she tested negative, but hasn't fully recovered either.
I have really bad joint pain. I still have this pressure in my chest. I also had a lot of confusion where I'll have to read things several times, 2 or 3 times, in order to comprehend what I'm reading.
McKinney's experienced some stranger side effects too, including loss of hair and the sensation of burning skin.
My skin was just on fire.
Studies show COVID-19 patients may experience lingering symptoms from lung, kidney, heart, brain, and nervous system damage caused by the disease.
They left the hospital because they were well enough to get out of hospital doesn't mean that they're healthy.
Dr. Mafazur Rahman leads a post-discharge clinic for COVID-19 patients at SUNY Downstate's Brooklyn Hospital. The clinic taps into different specialists to help patients recover and learn more about the disease.
Yes, COVID-19 involves the brain, the nervous system, the skin, the kidneys, the heart, the lungs, the GI tract.
It sounds like the message you're saying is just because you've survived COVID, you are not out of the woods. There may be long-term lingering effects on multiple different organ systems.
Yeah, I mean, absolutely. Patients may have lingering side effects that is not apparent yet, but it will be apparent a few months, few years from now.
I got sick March 15th of this year, and I've just never gotten better.
Amy Watson tested positive for the coronavirus with mild to moderate symptoms in April. She's tested negative 3 times since, but she's still in pain, has shortness of breath, and memory loss.
I've had a fever the entire time.
She started a Facebook support group with more than 6,000 members for long-haul COVID-19 fighters like herself.
We don't want to be second-guessed. We want to be believed, and we want doctors to tell us, hey, I don't have the answers, but I'm going to help you find them anyway.
We're survivors. We will get stronger. We will beat this. Hopefully in the years to come, we'll just look at this as a bump on the road and we'll be back to our normal selves or even better.
And Dr. Tara Narula joins us now. Tara, good morning. The thing that surprises me the most in these lingering effects here is what we call brain fog, or the confusion, or the memory loss. What are doctors learning about the lingering mental effects of this?
Well, I'm really glad you asked about that, Anthony, because many of these patients are going to face a second battle, and that battle has to do with mental health conditions. Experts have told us they expect to see an uptick in depression, anxiety, and in particular PTSD. We know that in patients in general who come out of the ICU, they can be at risk for some of these conditions. But now imagine these are patients who've been seeing doctors in full PPE, spacesuits, without that connection. They've been socially isolated from their family, and they're coming back into a world that's completely different socially and economically. And so even, the patient that we interviewed, Ernesto Castro, in the piece, he said, I think I'll recover physically. I don't think I'll ever recover mentally. He was diagnosed with PTSD and gave us some examples about waking up with nightmares and a cold sweat. His 2-year-old daughter kind of playfully jumping on his chest while he was sleeping, and he pushed her off, feeling that sensation of being suffocated again, like that when they were putting the mask on him and he was being intubated. So really important for families to know that when their family members come home, they may be at risk for this, for doctors to be screening, and very important for patients to know if they experience any of this to please speak up and speak to their provider and get help.
Yeah. All right, Dr. Tara Narula, thank you so much.